G'day everyone, this is Health Highlights. Health Highlights is a show about health professionals and the people and the stories behind the names that we hear about but we seldom get to meet. Now, this year alone, 7 million people will have X-rays and 3.5 million people will have a CT scan. So we wanted to dig a little bit deeper into this amazing profession called radiology. And we have with us today the owner and the head guru when it comes to radiology of InFocus Radiology here in Warners Bay. Ian, welcome Ian.
Thanks Simon. Hi everyone.
Hi everyone. Well look, I'm the right way up now, so I thought it's a lot easier to conduct the interview this way up. So look, thanks Ian for letting us come a part of your new premises. How long have you been here for?
Simon, thanks for having me. We've been here about 4 months at Warners Bay in the new premises. We had a little shop before, but now we've grown and grown to a much bigger practice and very happy, doing good.
Yeah, it's a wonderful building and a great facility. So look, it's been great to have a quick tour. So we want to talk about radiology. It is an interesting topic that I'm sure many people are interested in. So firstly, can you tell us, there's a really interesting story behind the actual creation of X-rays. So can you tell us a little bit about how X-rays came about?
Yeah, well, there was a guy, a German physicist named Wilhelm Röntgen. For most of the Aussies, they say William Röntgen. He discovered X-rays in 1895, just by accident really, working on a few things. But they discovered after that that it had really good penetrative properties, and within weeks it was actually being applied to looking for bullets in the wounded. So there was a lot of potential, and a lot of people started getting in on the act and really trying to discover the this newfound potential in these X-rays.
And look, X-rays have been used for multiple things throughout the years. There's a couple of things can you maybe tell us a little bit about that they've been used for that maybe they shouldn't have?
Well, the one that sticks out the most is hair loss. That's right, hair loss. A year after they discovered X-rays, they thought that it was a good idea to apply it to removing hair. But they soon discovered after the hair loss, the properties of actually the X-rays were being harnessed were not very healthy for the individuals wanting hair loss. So the removal of hair was very quickly eliminated from the potential use of X-rays. Since then, lots of things have been applied for X-rays, towards X-rays and the technology. One of the things is mainly with medical. However, there are things like non-destructive testing that some engineers use in industrial capacities. And also, if you've ever gone through an airport, they scan your bags with X-rays. So yeah, that sort of thing comes to mind.
And so look, that leads to the next question. What are some of the X-rays that we have available, and what are some of the things that are actually looking for in our bodies? Because there's not like, there's ultrasound, there's X-ray, there's CTs. Can you just give us a bit of an idea of each of them?
Yep.
And maybe how they are a bit different?
Okay. Well, when it comes to radiation and use in medicine,
yep.
There are different types of radiation that can be used in radiation. The main one is X-ray. The technologies have grown, and there are different areas of medical imaging that use different sources of radiation. The one that comes to mind that we're most familiar with is just a plain X-ray that we get throughout the world, just examining bones and broken bones or chests or pathology, trying to detect abnormalities within the human body. We do that via the ordinary X-ray machine, CT scans, mammograms. When we want to study blood vessels, we use them in angiograms, and also all sorts of dental and facial imaging as well. So anything that requires a penetrative source that will penetrate and acquire an image on the other side is applicable, and the use of X-rays is very prevalent. We can't forget PET scans and SPECT scans, and they are really used for just picking up on cancers and stuff like that. But one of the main technologies that doesn't actually involve X-rays at the moment that is quite popular is called the MRI. The MRI is a technology that uses magnetic fields, and it's a whole different principle altogether, and it does not use radiation. Ultrasounds. We use high frequency sound actually to acquire our images. The technology of which with ultrasound actually came from submarines.
Yeah, right.
Submarines in World War II.
So really, it's only the MRI and the ultrasound that don't use radiation in the imaging that we have at the moment.
Correct.
Right.
So I guess there's lots of different imaging modalities and imaging methods and tools. None of them can really profess to do everything.
Yeah.
That's why you've got such a myriad of examination types and modalities and everything else, because your doctor will actually sit you down and talk to you about what's most suitable for whatever they're investigating at the time. The questions will come up and as to whether you're suitable for that type of imaging even. So not every modality can do everything, and certainly some modalities are not suitable for certain individuals.
And so that leads to the question that everyone asks and everyone is concerned about, which is around the actual exposure of radiation and exposing my body to these things that are going to cause potential cancer. Mm-hmm. So can you maybe talk into how much radiation do we actually encounter when we get an X-ray, mm-hmm. and how safe is it? Yep. And how can we protect ourselves?
It's a little bit ironic, Simon, that you have to irradiate someone to make them better. Mm. I guess when you start learning about radiation and in radiology and radiography, you're always taught that no radiation is safe radiation. However, having said that, your doctor and your practitioner will have generally weighed up the benefits of actually getting imaging done via having some radiation in order to get the benefits of the diagnosis as a result of that. I can happily say that most modern practices now, like InFocus, have very low dose radiation sources, and we use optimal industry best standards to acquire images for the least amount of radiation exposure to the patient. Hence, your referrer and also our patients have a certain level of confidence that we're working with as low a possible radiation exposure as feasibly possible. To give you some level of perspective, actually, not many people know this, Simon, but actually just walking around in our everyday life, we are actually being exposed to some level of electromagnetic radiation as we live our normal lives. So I guess that's the perspective. I mean, we're always under some level of exposure.
So I suppose the question would be then, okay, if that's the case, how much more exposure are we getting when we have an X-ray compared to just general life? Do you know the stats around that?
I don't necessarily know, because it's person to person, and it's also depending on what sort of conditions that person might actually have. If a person is in intensive care, they may actually be getting multiple X-rays of their chest in one single day. If you're a healthy individual that's just sprained your ankle because of a weekend accident, you may have had your first X-ray in your life. So it's very difficult. That's where the practitioner and the referrer really is responsible for assessing the amount of exposure.
So, but in terms of, like, if you have one X-ray from none, would you have a 2 or 3 times more exposure to radiation? Do you know?
That is a very, very difficult quantitative question as well, because it depends on what sort of X-ray you're having.
Yes.
Naturally, an ankle or a finger X-ray might be of a less dose than that of a hip or an abdomen. Yeah. So it's really hard to sort of quantify how much is how much and how much is risky, which all comes down to our basic principles for radiology, and that is as low as reasonably possible.
Yeah.
So wherever you go, be it InFocus Radiology or somewhere else in Australia, we're hoping that all those practitioners are being very careful and conscientious and are actually practicing as low as reasonably possible.
Very
Yeah.
good. So with your industry, I'm sure there's a lot of misconceptions. Is there a few misconceptions that are very common that you can maybe share with us and debunk?
Yeah, I actually spoke to some of our staff members about this particular question, and for the radiographic staff, one of the misconceptions that they tend to be a bit fazed by is that radiographers just push buttons. They would like the public to know that radiographers are highly trained individuals who know human anatomy. They know the right amount of positions and projections and all that to achieve the desired outcome for the referrers and to get the proper diagnosis. As a sonographer myself, one of the misconceptions is that ultrasound is only to scan babies. It isn't. Ultrasound is being applied to many areas. But the general idea is that if it's a soft tissue part of your body, ultrasound can achieve lots of good things for you.
That's great. That's great. So I suppose another big question, you sort of brought up MRI before.
Yep.
CT versus MRI.
Yes.
What is the basic difference between the two? Mm-hmm. And is there any difference in the actual imaging that you get between one person and the next?
Yes, absolutely. First of all, there are actually benefits for both. And for those people who say MRI is superior to CT, I think that's incorrect. The general principles of CT, as we spoke of before, was that it requires radiation to acquire the image. And the basic principles of MRI is that it does not require radiation. It requires a large magnetic field produced by electricity to acquire your images. CT is superior in lots of different areas, mainly being that of imaging of bone.
Yep.
MRI is less superior. However, MRI is wonderful for soft tissue, neurological, brain,
Yep.
and spinal cord imaging, soft tissue in muscles and joints and cartilage anatomy. However, the contraindications of MRI tend to be a little higher than that of CT. Why? Is because CT is quick, simple, and it's readily available. Nowadays, especially with some of the newer machines available, the dosage on some of the machines for radiation is very low, so it's very quick, very easy, and the images acquired are extremely good. MRIs, however, have, I think, a few more contraindications in the sense that if anyone's ever had an MRI in a full-blown scanner, it is a very, very claustrophobic tunnel, of which it's actually quite creepy and quite hard and difficult for some people to actually enter and actually stay there for upwards of about 40 minutes. So for those people who have confined space issues, it's actually a very, very difficult concept to undergo. The other thing about MRI is, as we've said before, being that of a magnetic field, some people with metallic implants, pacemakers for that matter, are absolutely contraindicated because the pacemaker would stop working and in fact it would actually cause a lot of damage.
And for those who don't understand, contraindication is that you shouldn't do it. That's a medical word, just for those who may not be aware.
Yep.
So, and look, final question.
Yes.
It's been very interesting to hear the background into all of this. Is there anything new coming? Any new technology out there or on the way that may be revolutionising the way that we image people?
Yep. Currently, most of the advancements are coming in through reducing radiation dose.
Right. Yep.
So scanners like that we have in InFocus at Warners Bay as well as Belmont are requiring images at a very, very low dose. A lot of research have been put into a lot of the bigger companies to actually reduce the amount of radiation for the same amount of image quality.
Right.
So what we were having 5 years ago, and the amount of radiation required to actually get those images has effectively almost been reduced by 5 times in certain areas.
That's amazing.
Yeah.
That is very good.
So not only are you getting actually probably superior images, but you're using less radiation to acquire it. So the technology has been invested in that, not so much as trying to find new pathways and new types of scanning, but rather developing what scanning there is. The other thing, probably not as obvious to the average user, is that a lot of internet and a lot of high-speed image transfer and stuff like that is being developed by a lot of companies to allow access and movement of information, and a lot of technology has actually gone into that sort of information sharing. So yeah, that's probably not as obvious to the regular user, but it's certainly very significant in our industry.
Wonderful. Well, there you go. Well, that's some fabulous information for you to digest and take away. Thank you, Ian, for allowing us to come into this amazing facility. If you want to check out Ian and InFocus, you can check out all their details. Will be on the screen for you right now. Look, thank you everyone for joining us. Have a fantastic week. We'll be here the same time, 12:30 next Wednesday, with another incredible interview for you. Remember, have a great week. Healing is a gift, health a responsibility. Have a great week.
Bye.